Hi, I'm Dr. Michael Walsh, and I'd like to personally welcome you to our neurosurgery clinic today. Now, whether you're here for evaluation of a brain condition or a spine condition, most likely we'll be reviewing your MRI with you. Now, when you actually meet with our team, we're going to have a lot to talk about. So in preparation for your visit, I'd like to start talking to you a little bit about the anatomy and the principles of MRI.
Let's start with a brief review of the spinal anatomy. The spinal column is made up of bones which are stacked on top of each other, kind of like building blocks. Between those bones are what are called intervertebral discs, which act as shock absorbers. In the back part of the spinal column, we have a series of joints, which allow for some motion of the spine, but can also be a source of disease. Now, all of these structures create a series of tunnels through which the spinal cord and the nerve roots pass as they transmit information between the brain and the rest of our body. Although an MRI is not a perfect representation of these, it does give some very useful information about the status of our spinal columns, as well as the spinal cord and the nerve roots. Now imagine that we could open up the spinal column as if it was a book and take a look at its contents inside. That's essentially what you have with the first MRI sequence that I like to look at. We call this the sagittal or side view of the MRI. I like to look at this because it gives a good overall sense of the alignment of the bones, the status of the intervertebral discs, as well as how open or narrowed the spinal canal has become. Today we will likely scroll through your MRI as part of your visit. However, I don't only like to look at one view of the MRI. I've found that the down the barrel view, so to speak, is also very useful. This can give me a really good sense of what the nerve roots look like in the spinal canal, as well as how much room there is, and what structures, if any, might be putting your nerves at risk. Although this is obviously not an exhaustive overview of MRIs, it will hopefully at least provide some background in preparation for your visit with our team today.